Hello everyone, welcome back to my channel Medical's Guide. It's Dr. Ida Khan, and in this video we'll be talking about muscular dystrophies. First of all, I would like to apologize from all of you for not uploading videos for so long as I was busy with my exams and other stuff. But from now on, I'll be uploading videos regularly, so stay tuned and keep watching. Okay, so first thing first, we'll be talking about myopathy. So, introduction to myopathy is that myopathy simply means muscle disease. In Greek, myo means muscle and pathos is for pathy or suffering. Muscular dystrophy encompasses a group of over 30 genetic conditions that impair muscle function. These disorders, classified as myopathies, specifically affect skeletal muscles and tend to worsen progressively over time. The impact of muscular dystrophy varies depending on its type, potentially hindering movement, walking, and daily activities. In some cases, it can also compromise the muscles responsible for heart and lung function. Certain types of muscular dystrophy appear at birth or during childhood, while others manifest later in adulthood. Now let's discuss other definitions of muscular dystrophy. Muscular dystrophy is a genetic disorder and this occurs when there is incorrect or missing genetic information that was basically responsible for making the proteins for healthy muscles, so this results in gradual weakness of body's muscles. In other words, it is a muscular disorder in which face, arm, leg, spine, or heart muscles or conduction tissue and other parts of nervous system gradually shrink and weaken over time. Now, epidemiology. Muscular dystrophy is considered a rare condition, with all types affecting approximately 16 to 25 out of 100,000 people in the US. Duchenne muscular dystrophy is the most common form in childhood, while myotonic dystrophy is the most prevalent in adulthood. Incidence of DMD was found to be 1 per 3,000 to 3,500 male births. Two-thirds of the cases of the DMD are due to genetic mutation on the X chromosome, while one-third of the cases result from spontaneous mutations. It is very rare to find DMD in the girls or women. Now let's talk about symptoms. The type of muscular dystrophy defines the symptoms. But the primary symptom is muscle weakness along with other muscle-related issues. Different form of muscular dystrophy affects different muscles and different areas of the body, and symptoms typically worsen over time. Now, the common muscle and movement related symptoms may include muscle atrophy, difficulty walking, climbing stairs, or running, abnormal walking gait, stiff or loose joints, permanent tightening of muscles, tendons, and skin, spasticity, or muscle pain. Other potential symptoms include fatigue, difficulty swallowing, heart issues, problem in spinal curvature, for example, scoliosis, breathing difficulties, intellectual disabilities, or learning disorders. Symptoms of some types of muscular dystrophy are mild and progress gradually with age, while other types cause more rapid muscle weakness and physical disability. Now let's dive into etiology. As we've discussed earlier, the muscular dystrophy is caused by mutation in the genes which are responsible for maintaining healthy muscle structure and function. And therefore, the cells that are responsible for maintaining muscle health are prevented to perform their job, and therefore it leads to progressive muscle weakness over time. There are no specific genes that are targeted, but several genes can be affected, and which is why we see that there are so many different forms of muscular dystrophy. In most cases, the genetic mutations are inherited from one or both biological parents. Now, let's talk about the pattern of inheritance. Muscular dystrophy can be inherited in three main ways, depending on the specific type. So, now let's talk about each of the inheritance pattern one by one. So, first of all, we have the recessive inheritance. It means the person would inherit the genetic mutation from both biological parents. This pattern is followed by some forms of limb girdle muscular dystrophy. Now let's talk about another inheritance, that is dominant inheritance. Here, inheriting a mutated gene from just one biological parent is enough to develop the condition. Myotonic dystrophy, facioscapulohumeral dystrophy, and oculopharyngeal muscular dystrophy are some examples. Now let's talk about the X-linked or sex-linked inheritance. So this pattern occurs when there is mutation on X chromosome. In a male person, as males carry one X and one Y chromosome, so they will develop this condition only if the X chromosome carries the mutation. While in a female person, as the females have two X chromosomes, so they will have the X linked disorder, but the symptoms are typically milder. Duchenne and Becker muscular dystrophies are the instances. Now, in rare cases, the muscular dystrophy may also develop due to de novo mutations. By de novo mutations, we mean the mutations that occur spontaneously and are not inherited. Now, as we know that there are proteins that protect the muscle fibers from damage, and these proteins are encoded by hundreds of genes. Now, what happens when these genes get defective? So, the muscle condition that occurs is called the muscular dystrophy, in which there is progressive muscle weakness over time. And different mutation leads to different forms of muscular dystrophy. And these mutations can be inherited or they can also occur spontaneously in the mother's egg or developing embryo. Now let's move on to clinical features. Now, the symptoms of the most common type of muscular dystrophy begin in childhood, primarily in boys, while in other types of muscular dystrophy, the symptoms don't occur until adulthood. And these clinical features are breathing or swallowing difficulties, contractures, there may be a waddling gait, having difficulty going upstairs, toe walk, calf pseudohypertrophy, but there is no fasciculation or sensory loss. Now, the DD of the muscular dystrophy can be established as spinal muscular atrophy, congenital myopathies, other muscular dystrophies, especially the limb girdle, polymyositis, and other muscle diseases. Now let's talk about other forms of muscular dystrophy. There are more than 30 types of muscular dystrophy, and some of the more common forms include Duchenne muscular dystrophy, myotonic dystrophy, Becker's muscular dystrophy, facioscapulohumeral muscular dystrophy, limb girdle muscular dystrophies, Emery-Dreifuss muscular dystrophy, oculopharyngeal dystrophy, distal muscular dystrophy, mitochondrial myopathies, and congenital muscular dystrophies. Now let's discuss them one by one. Now, before we go into different types, we must first know how to distinguish between each of them. So, there are certain characteristics that you must keep in mind before studying each of them so that you may remember how to differentiate between them. First of all, the age at which the symptoms usually start, the pattern of muscle weakness, speed at which the disease progresses, involvement of other tissues beside muscles, pattern of inheritance. Now we have risk factors. So, muscular dystrophy occurs in both the genders, in all ages and races, but most commonly it is found in young boys. Then, those people who are having a family history of the muscular dystrophy, they are at the higher risk of developing this disease and also passing it on to their children. Now, let's discuss about the complications. Muscular dystrophy can present with the following complications. It can shorten the person's lifespan, it can cause respiratory failure, reduced efficiency of the heart muscle, problems in swallowing, problems with coordination and mobility, muscle weakness, joint stiffness, contractures, balance, and scoliosis. Now let's discuss about each type. So the first type here is congenital muscular dystrophies. Congenital muscular dystrophies represent a group of conditions that manifest at or shortly after birth. As the term congenital signifies present from birth. These disorders are characterized by generalized muscle weakness and may also cause joint stiffness or looseness. Depending on the specific type, CMD can be associated with spinal curvature, that is scoliosis, respiratory difficulties, intellectual or learning disabilities, vision problems, or seizures. Here's a diagram representing congenital muscular dystrophy, and here the generalized muscle weakness can be seen. Now let's talk about Duchenne muscular dystrophy. Duchenne muscular dystrophy is the most prevalent type of muscular dystrophy. It primarily affects children assigned male at birth, though children assigned female at birth may experience a milder form. As the condition advances, it can impact the heart and lungs. It's X chromosome muscular dystrophy caused by the specific defect in the gene coding for production of dystrophin, a structural protein of the cytoskeleton that anchors intramuscular filaments. Symptoms appear early, usually between the ages of 1 and 6. The condition progresses quickly, with many people needing a wheelchair by the age of 12. Typical symptoms plus fatigue and problems with the bones in the back and chest. Those with the condition may eventually have trouble breathing and develop pneumonia. Now, this figure is an illustration of a Gower sign. Gower sign is a clinical sign observed in Duchenne muscular dystrophy, a genetic disorder characterized by progressive muscle weakness. It refers to the characteristic way children with DMD rise from a sitting or lying position. Due to weakness in the proximal muscles, especially in the hips and thighs, the child uses their hands and arms to walk up their thighs to stand upright. This maneuver compensates for the lack of strength in the lower limbs and is a hallmark of muscular dystrophies. In this figure, you can see there is a dystrophin protein. Dystrophin is a vital structural protein found in skeletal, cardiac, and smooth muscles, as well as the brain. It is part of the dystrophin glycoprotein complex, which connects the cytoskeleton of muscle fibers to the extracellular matrix, providing structural stability during muscle contraction. Mutations in the DMD gene which encodes dystrophin result in its absence or dysfunction, leading to muscular dystrophies like Duchenne, in which there is absence of the dystrophin protein, and the Becker muscular dystrophy, in which there is reduced or abnormal dystrophin. These conditions cause progressive muscle weakness and degeneration. Here's a boy representing characteristic features of Duchenne muscular dystrophy, and these features are: shoulders and arms are held back awkwardly when walking, sway back, weak butt muscles, knees may bend back to take weight, thick lower leg muscles. The muscles is mostly fat and is not strong, and this is usually referred to as pseudo hypertrophy of the calf muscles. Tight heel cord, which is basically the contracture of tendon Achilles. Then there are weak muscles in the front of the leg, and this would cause the foot drop and tiptoe contractures. Then awkward clumsy if walking, poor balance, falls often, thin weak thighs, and belly sticks out due to weak belly muscles. Okay, that's all for today's video. I'm ending this video up till here as the video has gone much long. So we'll meet in the next video. See you later. And if you find my videos helpful, don't forget to like, share, and subscribe to my channel. Thanks for watching.